HIV infection remains major concern in Mombasa. HIV infection continues to be a major public health issue in the coastal city of Mombasa with significant morbidity and mortality rates. According to the National Syndemic Diseases Control Council, NSDCC, AIDS remains one of the leading causes of mortality in the port city. The National Council is mandated to manage the following syndemic diseases: HIV, sexually transmitted infections, malaria, leprosy, tuberculosis, and lung disease, NSDCC. In its latest report to the Mombasa County Multi-Sectoral Coordination Committee, stated that in 2023 about 631 people, 515 adults and 117 children, died from AIDS-related illnesses, despite the availability of life-saving antiretroviral therapy, ART. This, the NSDCC notes, leaves no room for complacency, with much work remaining, particularly in addressing the root causes of HIV, which sustain high levels of vulnerability in sectors of the population. NSDCC Coast Regional Coordinator Omar Mwanjama told a multi-sectoral committee meeting that HIV remains a significant public health threat with the potential to negatively impact the development agenda of the coastal city. The county has an HIV prevalence rate of 4.4% with an estimated 54,361 people living with HIV, he said. He added that among the 54,361, 2,422 are children aged 0 to 14 and 51,939 adults aged 15 and above. Mwanjama said an estimated 349 males died of AIDS-related causes in 2023, compared to 378 females. The county recorded 52,276 people, 50,916 adults and 1,360 children, living with HIV on ART, representing 96% coverage in 2023, he said. The report noted that females are disproportionately affected, with a prevalence rate of 6.2% compared to 2.6% among males. The number of AIDS-related deaths, albeit in the county, has reduced by 64% from 2,351 in 2013. The report further notes that access to HIV services to prevent mother-to-child transmission remains suboptimal at 88%, with only 1,409 out of an estimated 1,605 women living with HIV accessing prevention services to reduce vertical transmission. In addition, only 53% of HIV pregnant women delivered under skilled birth attendants in 2023, signifying a high risk of mother-to-child transmission during delivery. Mwanjama disclosed that the number of sexually transmitted infection cases, although on the decline from 8629 in 2021 to 7395 in 2023, are still alarmingly high. An estimated 84 new HIV infections occurred among adolescents aged 10 to 19 years in 2023, a decline of 88% from 681 in 2015. 1 in every 10, 3,208, pregnant women attending the first antenatal care clinic was an adolescent girl aged 10 to 19 years, said Mwanjama, who also decried the decline in HIV/AIDS funding programs. The NSDCC report further highlights that about 420 sexual and gender-based violence (SGBV) cases were reported among adolescent girls aged between 10 to 17 years, representing 48% of all SGBV cases. The county achieved 52% coverage with HIV comprehensive services among female sex workers and 162% among people who inject drugs, with optimal coverage, 100%, among men who have sex with men program in 2023. Mwanjama stated that to sustain the gains made in the HIV program, Mombasa will need to intensify HIV prevention services for adults and children and increase antenatal clinic attendance and skilled birth delivery and services. There is a need to strengthen identification and linkages to ART and viral suppression among children, adolescents, and young people, he said. Mwanjama added that allocation of domestic resources to implement the county AIDS implementation plan will strengthen and accelerate progress towards ending AIDS as a public health threat.